Welcome back to This Week in Immigration. I'm your host, Jack Malday, Associate Director at the Bipartisan Policy Center. In this week's episode, BPC Senior Advisor Theresa Cardinal sits down with Amanda Bergson-Shilcock, Senior Fellow at the National Skills Coalition, to discuss the importance of our workforce development system, the urgent need to address skills gaps, and the role that immigrants can play in meeting them. It's a workforce-centric episode of This Week in Immigration, so stay tuned.
The care workforce in the United States is approaching a crisis point as 6 million current workers face low wages, limited advancement, and little policy recognition, despite the growing demand for care workers projected in the future. Meanwhile, the Trump administration's immigration enforcement policies are creating challenges in this sector, one that includes a large number of women, immigrants, and people of color. However, organizations like the National Skills Coalition suggest that targeted immigration and workforce development policies can provide a path forward. To help us explore this topic, we are joined by Amanda Bergson-Shilcock, a senior fellow at the National Skills Coalition, where she leads work on adult education, workforce development, and immigrant integration. For over a decade, Amanda has worked in adult learning, immigration, and workforce development, advocating for more inclusive and effective education and training systems that help all workers. Her work focuses on immigrants and adult learners, helping them gain the tools they need to thrive in the modern economy. So welcome to the podcast, Amanda.
Thanks so much. I'm delighted to be here.
Great. So first, why don't you tell our listeners about the National Skills Coalition, its mission, and its work overall?
National Skills Coalition is a Big Tent bipartisan coalition of workforce and education advocates. We have more than 20,000 members across the country. They include workforce development boards, community colleges, nonprofit organizations, adult education providers, career technical education programs, labor unions, labor management training partnerships, chambers of commerce, really anyone with an interest in making sure that workers have access to high quality education and training opportunities, and that small businesses have opportunities to get the skilled workforce they need. We recognize that immigrants are more than 1 in 6 U.S. workers, and we think it's crucial that immigrant workforce issues be part of conversations about the U.S. workforce at large.
Yeah. So it's really a big tent. And, as we've mentioned before in this podcast, the Bipartisan Policy Center recently launched its Commission on the American Workforce, covering a lot of those stakeholders that you just mentioned. We've also done work with our health policy program on the care workforce. And the coalition has been focusing on this a little bit as well. How do you define the care workforce, and what are the challenges it faces?
Yeah, that's a great question. So the mission of National Skills Coalition, as I said, is, we're a policy advocacy organization. We work on state and federal policy to make sure that workers have access to high quality skills training to support themselves and their families, and that businesses have access to the skilled workforce they need. What do we mean when we say care workforce? So the care workforce encompasses roughly 6 million workers who are caring for children below the age of 5, so early care and education, adults with disabilities who need personal care and other support services, and elders who need either physical or other kinds of healthcare supports. It's a big umbrella when we say care workforce, but most of us at some point in our lives as adults or elders will need care, and all of us needed care as children. We hear a lot in the news these days about the sandwich generation of working adults who have children that need care and also aging parents that need care. Of course, there are adults of all ages who have disabilities who need care, often so that they themselves can participate in the workforce. So when we think about the care workforce, it's that 6 million number that I mentioned a minute ago, and that includes everyone from home health aides and personal care aides to certified nurse assistants, folks who provide care in the home, but also folks who provide care in residential settings that aren't individual homes. So group homes for folks with disabilities or nursing homes, sometimes hospitals. For early care and education, some early educators are providing care one-on-one. You You can imagine like a nanny type position. Others are doing it in small group settings, like a family daycare where they might be caring for a half dozen young people. And others are part of center-based daycare or early care and education programs. So it's a wide array of workers in terms of their occupational settings. But the demographics of this workforce, I think, are particularly important when we think about immigration. Care is disproportionately provided by women of color in particular, and by immigrant women even more particularly than that. And so when we think about the care workforce, we really have to be intentional about recognizing that a disproportionate portion of the care workforce are people who have come to the U.S. from elsewhere and who are contributing their skills and their abilities to support U.S.-born workers and families at all segments of that lifespan, as I mentioned. We think about the challenges of this workforce, it can be really isolating. You're working often individually out in the field with what some folks call a patient or a care recipient or a care consumer. There's kind of various titles for that. A lot of these workers are 1099 independent contractors, so they're not W-2 payroll employees. That means they might not have the same training and professional development opportunities that folks might have if they were in a different kind of job. It's often the case that even when people get additional credentials or certifications, their wages don't rise to match their increased skill level. Many care workers are themselves reliant on programs like SNAP or food assistance, Medicaid for healthcare coverage. And so there are a lot of challenges in providing high quality care in a field that offers, unfortunately, a lot of precarious and low paid jobs. So those are some of the challenges that we see facing this workforce. And as I said, it faces all workers in the workforce, but because immigrants disproportionately make up a portion of the workforce, it's certainly an immigration issue.
Yeah. So you mentioned that immigrants are disproportionate in the care workforce, and we've done a lot of discussion about how many immigrants work in a lot of different fields in the United States. And yet they do face challenges to employment and advancement. You mentioned some of them, like if they are independent contractors, they don't have access to employer provided skills training or skills development. What are some of the other challenges immigrant adults face when they are trying to enter or advance in today's labor market?
Yeah, that's a great question. So a few things that we see come up over and over again. The first being, if folks do bring credentials from their country of origin, it can be tricky to transfer those credentials to the U.S. So you might have worked as a registered nurse or even a physician in your home country. When you get to the U.S., if you want to re-credential in that profession, it can be a long and complex pathway. And so many folks who have higher level healthcare credentials will get a short-term credential here in the U.S. Okay, I was a physician at home. I can't actually take the time to go do all of my medical licensure exams here in the U.S. and do a medical residency here in the U.S. so I can practice as a physician. So instead, I'm going to do a short-term certification so that I can practice in the healthcare field, even though I won't be allowed to practice as a physician, right? So that's one challenge, is that folks who have credentials from abroad often face lengthy and expensive challenges being able to transfer those credentials to the U.S. A second challenge is that a lot of folks are still building their vocational specific English skills. So you can think about it from a basic perspective of, okay, there's what we kind of jokingly sometimes call survival English, right? Can you engage in basic conversation? Can you kind of go about the activities of your daily life with English? That may be true, but even if your English is pretty good on that level, it doesn't necessarily mean that you're good with healthcare jargon. And anybody who's ever sat in on a doctor's appointment with an elder relative or heard instructions from a physical therapist about what to do knows that there can be specialized vocabulary around the medications you're taking or the exercises you're supposed to do. And so one challenge for immigrant healthcare workers is getting access to vocational English classes that can help them build the English skills they need to be knowledgeable in supporting the people they're caring for. In early care and education, of course, you're working with children who are still developing their vocabulary skills. And so in many cases, the vocabulary that those teachers need is really around child development and child psychology, being able to talk with their fellow early educators about issues that they're seeing with children in the classroom or things that have bubbled up with the young people that they are caring for, and being able to talk in a knowledgeable way and have the vocabulary necessary to talk about, I think this young person might have a speech delay. We should let the parents know, or similar kinds of more specialized conversations that, might not be the first vocabulary you learn when you come to the U.S. and you're learning English. And then the last challenge I'll lift up in terms of immigrant workers in the labor market is when it comes to changing jobs. Again, I mentioned sort of the many freelance workers effectively that exist in this workforce and the kind of precariousness of their jobs. If you're caring for somebody who goes into the hospital and doesn't need your home care services anymore, or someone who's at the end of their life and passes, or a child who ages out of early care and education and moves on to elementary school, you're reliant on the references of your past employer to help you connect to future employers. But because people are in these oftentimes very isolated one-on-one situations, if anything goes wrong with that employment situation, it can be really tricky to have a reference to go on to find your next employer with. So those are some of the challenges that we see coming up again and again for immigrant and other workers in care economy jobs.
Yeah. There's also a distinction between sort of adult learners and younger students. So, someone graduating high school gets a certification or goes right into some sort of post-secondary training. Many adults are coming to these learning situations after already having been in the workforce, maybe in another career, or as you said, had a career in another country, have to start in a kind of different place here. What are some of the structural barriers that just being an adult learner in the situation also come into play?
Yeah, let me start with a quick story. So in my previous job, I worked directly with immigrant job seekers. We had one job seeker who had been a chemist in her home country of Ukraine. She got to the U.S. Her husband, quite unexpectedly, had a major health issue and couldn't work, and she had 3 children. And she could not immediately find work as a chemist here in the U.S. Her English was still developing. She didn't have lab science experience that was immediately relevant to the kinds of job openings that existed. And so she decided to take a quick 3-month CNA course, a certified nurse assistant course, so that she could work in the healthcare arena as quickly as possible. And when you're making that kind of decision, you need training that is either free or low cost because you're not working, right, and can't immediately pay out of pocket for it. You ideally need it to have flexible hours, right, because you may be caring for your own children and not have the ability to attend classes in the evening if your kids are home from school at that point and you need to be with them. There may be transportation challenges. If you have just recently arrived in the U.S. and don't own a car yet, you might be dependent on public transportation to get to classes. And you also are vulnerable to misinformation or just confusion about what's a good use of your time. Some workers are accidentally told, oh, your credentials aren't worth anything. You have to go get a GED here in the United States, right? Which is not true. Don't need to take up a slot in a high school equivalency class in order to pursue a healthcare credential if you're coming here and have already finished high school in your home country. So, if you're a young person coming right out of K-12 education, you're 18, 19 years old, you probably don't yet have children of your own to juggle. You may even be able to still live at home with your parents and not have to have immediate income. For adult learners, you have to figure out your income challenges. You have to figure out your transportation. And for parents, you often do have to figure out your transportation challenges. Those are some of the factors, and I know that BPC has looked at these issues, and there may be other factors that you're thinking of that are worth lifting up in this conversation about, that can create unnecessary barriers for workers.
Yeah. We've looked at a lot of aspects of this from our Working Families program that looks at the care workforce, the availability of care and or training outside of normal working hours, right? So somebody who already has a job is looking to get training in another job needs to be able to have availability of that outside the normal working hours that they may have, or if they're in a schedule that shifts, even a regular time slot may not work for them. So there's lots of those kind of just structuring your life to be able to take this course that you hope will get you into a more stable position or a more regular type of job. There's a lot of, and I think many of us who are adults and have been juggling different types of these things have at one point or another in our lives encountered that time where we just can't make everything work together.
Yeah. Yeah.
I know when my schedule just looks crazy. I'm like, I don't know how I'm going to make this. But for some of these folks, it's a lot hard. So we're going to take a short break. And when we come back, we'll talk a little bit more about the role immigrants can play in addressing some of these workforce gaps and the means they can use to get some of the skills training that they may need. So stay tuned. And we're back. So we obviously are seeing a lot of enforcement against undocumented immigrants in the United States right now. But even immigrants who are legally allowed to work still face barriers. And I know your work focuses a lot on those workers who are eligible for a lot of these workforce development supports, education and training programs, which do require some sort of status for the most part in the United States. We probably should explain to our listeners, and with the caveat that some of this may be changing under the new administration, but in general, who is eligible for, say, federally funded or maybe some state funded workforce development assistance and training?
Yeah. So I know listeners of your podcast will be very familiar with the reality that immigration status is a spectrum, right? It's not black or white. Some folks may be naturalized U.S. citizens. That's about half of all immigrants in the U.S. Some folks may be green card holders or lawful permanent residents. That's about another 25% of immigrants. And then the remaining 25% is divided among undocumented immigrants and people with what we sometimes call more liminal statuses or in-between statuses of temporary protected status or humanitarian parolees, asylum seekers, or people who've been granted asylum, which confusingly is called asylee, doesn't roll right off the tongue for folks who aren't specialists, refugees. And so broadly speaking, if you have a permit to work in the United States, you are generally eligible for federally funded workforce training programs. That is kind of the broad brush. There are nuances to that, but that's the broad brushstroke. There is a subset of folks with legal work authorization who are eligible for Pell Grants, which is the primary way that low-income people pay for college or career technical education. And Pell Grants are available for what is called eligible non-citizens, which typically has traditionally included green card holders, people with refugee and asylum status, and a handful of other humanitarian statuses. As Theresa mentioned, there's some changes going on now with the current administration. So the lines on these are shifting somewhat, but in broad strokes, that's important to be aware of. Traditionally, it's also been the case that immigrants of all statuses, including undocumented folks, did have access to some English language learning opportunities. This is also shifting under the current administration. So the terrain is pretty uncertain right now for some of the nuances and the details around this, but that's the big picture.
Yeah. And as we mentioned, the current administration has taken steps that some of those folks in liminal status are going to lose that status. The Trump administration has canceled temporary protected status for several groups, revoked humanitarian parole. But I think it is worth also saying, like, for example, foreign students in the United States don't have access to these programs. They're on a temporary non-immigrant visa. They're legally here, but they don't have the kind of longer term residence that would qualify them, neither somebody on a work visa, for example. So it's kind of, if you're not in the immigration field, understanding the differences of all these and the fact that the requirements for these programs are not set in the immigration law necessarily. They're set in the law that creates the programs. So it may be different, or the language used may be different than that in immigration law of what is considered a legal resident or a legal immigrant in the United States. So you mentioned several different types of availability of programs for immigrants. How difficult is it for them to access those programs? We've talked about barriers, like life barriers, but like in terms of like registration, finding them, where and how do they go? Obviously, organizations like yours try to help connect people to those kinds of training, but what's that process look like?
So the U.S., for better and for worse, is a very decentralized country, right? We have 50 states. We have numerous counties within those states. In many states, like my home state of Pennsylvania, there are numerous municipalities within a given county. And so what's challenging about that is that what it looks like for an immigrant to access workforce services in one state or city may be different from what it looks like in other states or cities, because states take different approaches even to how they implement nationwide federal policies. Typically, when we see folks accessing services, it happens one of three ways. Either they get a direct referral from what I sometimes jokingly call the first responder for workforce. So you know what first responders in the emergency services field look like? Those are firefighters or police officers. In workforce development, that frontline staff member is somebody who works at an American Job Center, a workforce center, somebody who works in a nonprofit organization as a case manager, a public librarian, a person who is a student advisor at a community college, a guidance counselor at a high school. So for a lot of people, their entry point to a workforce program is one of those people, one of those frontline staff who says, oh, hey, did you know this program was available? Or did you know you're eligible for this? Or had you thought about pursuing this healthcare training? For other folks, the referral comes through a friend or a colleague, right? Immigrants are often connecting in the United States through other immigrants who've been here just a little longer than they have, and can say, oh, hey, I know this training down the street. My sister got it and it paid off for her, so you should think about it too. So that kind of friends and family referral is another way that folks access workforce and education services. And then finally, a smaller handful of folks, and it's really primarily refugees, get there through formal U.S. government programs that are designed to support refugees in particular. And I imagine that many of the listeners of this podcast are pretty familiar. There's a network of nonprofit refugee resettlement organizations in this country. Many of them provide workforce services themselves, and if they don't, they are connected through referral relationships with organizations that do.
Yeah, so lots of different ways they can access it. Now, we've also talked at the beginning about sort of the impact of immigrants in the workforce, but we've covered on this podcast that particularly the care workforce occupations and healthcare in particular are more likely to face workforce availability gaps now and in the future. And for those that don't remember, you can go back and listen to our podcast episode on our report on workforce gaps that was released earlier this year. What are the consequences? Some of it is getting people skilled into these occupations that may have a desire to get into these occupations. But what are the potential consequences of leaving some of these workforce gaps unaddressed if we don't have people with the right skills? And what's the career trajectory for folks? Like if they start at a certified nurse assistant or a home health aide, is there a career path with additional training that they could move on to?
Yeah, so the consequences are really important to be clear and honest about. Care work is often defined as the work that makes all other work possible. Last year, I was part of a friend circle caring for a terminally ill friend with brain cancer. If we had not had home health aides who could help support our care for our friend, we would not have been able to hold down our day jobs in the fields that we work in, right? And so when we don't have enough healthcare workers, that has ripple effects for all of the other workers who are depending on that care in order to help them hold down their own jobs. That's one consequence. Second consequence is really around mental and behavioral health. We have learned a lot as a society in the past few decades about the importance of mental health. We hear repeatedly for farmers and folks in rural areas, for folks who've survived natural disasters like wildfires or floods. Having access to mental health care, including through telehealth services as well as in person, is incredibly important in helping people maintain their mental well-being. If there aren't enough care providers, if there aren't enough immigrant and other workers with behavioral health skills to support people, we lose, there's a human cost to not being able to access that mental or behavioral health care. There's also productivity cost. There's an economic cost. The construction industry deals constantly with the consequences of folks who don't have enough access to addiction care services or other kinds of substance abuse disorder. The opioid epidemic is touching a lot of communities across the United States right now. If we don't have enough workers to serve the people who need those kinds of services, there are ripple effects that affect people's individual lives and our economy as a whole. And I think that's a really important and kind of under-discussed element of the healthcare field. The other thing I want to flag too is when we think about community health workers, sometimes these are called promotoras, so people who are sort of promoters of health. They can help folks with diabetes or other health conditions stay out of the hospital, right? If you're getting preventative care because a community health worker is checking in, helping you manage your diabetes or your asthma or whatever your chronic disease may be, that is helping you as a person in terms of your own well-being, but it's also cutting down on healthcare costs for our society because it's preventing hospitalization and other acute care costs that happen if people's serious illnesses are not managed well. So when we think about what are those ripple effects and those consequences of having gaps in the number of healthcare workers we need, those are some of the gaps we do.
How available is the kind of training necessary for these kind of workers? Is there if the number of people wanting the training, being able to provide that?
Yeah. So I would say fundamentally, we don't invest enough publicly in workforce training and education. And recent cuts in congressional allocations are frankly going in the wrong direction in terms of access to education and training. There's one very small bright spot in the reconciliation bill that just passed Congress. That bill did authorize something that is sometimes called workforce Pell or short-term Pell. It is the use of Pell Grant funding for high-quality short-term programs that is shorter than 16 weeks or 600 hours long. And that is a small bright spot in a bill that otherwise is really slashing public investment in the kinds of services and supports that are really crucial to building the skilled workforce that we need. And so when we think about, okay, who's investing in training, California had a really interesting initiative starting earlier this year. They got a multi-billion-dollar waiver from the federal Medicaid system to allow California to cover the training costs for a huge range of behavioral and mental health workers. So they could help cover costs for everyone from psychologists to drug and alcohol counselors to mental health support workers. That was an enormous positive step forward of a state thinking creatively about, okay, we have a need for more mental health workers. We have this flexibility in the federal policy that allows us to apply for a Medicaid waiver so that we can spend a portion of our Medicaid dollars on the training costs associated with building up this workforce. That is terrific. The fact that the reconciliation bill that just passed Congress is going to cut $1 trillion from Medicaid over the next 10 years is really undercutting that kind of innovation and forward thinking in investment and workforce and education strategies.
Yeah. So, obviously you have opinions about the direction of funding, but are there other kinds of policies or investments that the National Skills Coalition is advocating for to help with immigrant and other adult workers get the skills they need?
We're an advocacy organization, so yes, we do advocate for more funding. There are also revenue neutral policies that can be really powerful, right? And so when we think about what good policies look like. We advocate for more creative use of adult education funds to support integrated education and training opportunities. So integrated education and training, or IET, is the opportunity to build your English skills or your reading or math skills in conjunction with training for a specific industry or occupation. So you might want to train to be a phlebotomist, for example, so that you can take blood at the doctor's office or the hospital, but you're also building your English skills or your other foundational skills. That is an allowable use of adult education funding in the U.S., and we encourage more use of funding in those kinds of programs. We also encourage more partnerships between different kinds of organizations that are providing different pieces of the puzzle, right? So in some cases, there might be a labor management partnership of workers at a hospital who are unionized and whose wages get paid into a training fund. That training fund can be used to create a career pathway so that, you might walk in the door of the hospital and get your first job in environmental services, which is often what hospitals call janitorial or cleaning work. But then let's say you have ambitions to become a medical assistant and then to move from a medical assistant into a nurse aide and then a registered nurse role. If your training fund has worked with the hospital to create that kind of career pathway, you can see the milestones you need to hit and the training you need to get. And you can sometimes even get paid time off from your existing job for the hours that you're participating in training. So those are some of the kinds of policies that National Skills Coalition endorses and supports so that folks have different on-ramps and off-ramps. We can't assume that everyone's going to follow the same career or training pathway. And because folks come to training at different points in their lives, right? Not everyone is 18 years old coming right out of high school. So let's create different on-ramps so that people can enter and re-enter the workforce at different points in their life cycle as it makes the most sense for them.
Yeah. So at BPC, as part of our workforce commission, there's been a lot of talk here about the idea of earn and learn, which covers things like apprenticeships, but also I think maybe a little bit of what you were talking about, because we talked about one of the barriers is people who are holding a full-time job and also trying to get the training. And if you have a way to earn an income as you are learning on the job in some ways or through a training program, that can alleviate some of those barriers. So it sounds like we're thinking in similar veins about, how do you kind of combine the different modalities so that it is more available or flexible for more people. Do you see any momentum currently to address these issues, whether it's federally or are there state or local programs that you think serve as really good models for these kind of things right now?
Yeah, I want to build on what you just said about earn and learn approaches, right? Earn and learn is such a powerful model because a lot of folks cannot afford to quit their job in order to enroll in a training program. So one form of earn and learn in this country is the federal registered apprenticeship program. There are other, what I call kind of small A apprenticeship programs or work-based learning. And while folks often associate apprenticeship with the building trades or with labor unions, I want to draw the attention to a terrific program in South Carolina. So Apprenticeship Carolina is really the state government in South Carolina decided we like earn and learn strategies. We want to provide more opportunities for workers to access them. We recognize that a lot of employers don't have the time or the capacity to do the paperwork associated with setting up an apprenticeship. So we as state government are going to create essentially a technical assistance office in state government. And we're going to help employers navigate that so that more employers can offer apprenticeship pathways. South Carolina is not a state that's at the top of most people's list when you think about labor unions, and Apprenticeship Carolina is not limited to partners with unionized jobs, right? They are very clear that they are interested in supporting employers generally that want to create these pathways. And they're not limited to the building trades. They're very creative about which industries and occupations. So that's a great example, I think, of a state recognizing earn and learn is a powerful model. We want to help more workers be able to access it, and we want to make it easier for employers who want to do this. But, employers are running businesses and companies. They're running nonprofit organizations. They got 15 different things on their to-do list, becoming experts in apprenticeship paperwork is probably not high on their list, right? So how do we make that easier for folks? And there are some other, examples that I think are really effective. There's a great partnership that's happened between the International Institute of Minnesota, for example, and St. Paul College to create what they call bridge and support classes, so that folks who've come out of a certified nurse aide training at the Institute, which is a nonprofit organization serving immigrants and refugees, and then they want to go on to the community college to enroll in the next step in their career pathway, get some additional tutoring support. And this is a great example of a win-win. The program was created for immigrant students to begin with. And then once the US-born students saw it, they said, this would be really useful. Can we access it too? And the program was broadened to include US-born students who might need some support as they are moving from their earlier nonprofit organization-based training into the community college environment. And I think it's a beautiful example that sometimes what works well for one group of workers works well for other people too. And if you build something that fits for immigrant workers, it can also benefit US-born workers.
Well, one of the things that we are also talking a lot here at BPC, and this is not just about immigrants entering the workforce development space, but in general. And we've mentioned all of these different stakeholders, right? You have employers who are looking for workers with specific skills. You have training providers, whether they're post-secondary education or other training providers. You have state and local governments that have not just workforce development goals, but maybe they have economic development goals and they need workers in certain places to meet those economic development goals. And they can run programs too. There's just so many different, and the federal government, of course, has these programs that it offers. The challenge, do you see the challenges in sort of getting all of these folks on the same page? Is there a way that we can take some of these innovative things that you've talked about? Are they replicable in other parts of the country? Are there things that the federal government could do to, if not, to promote some of them or encourage more states to take on some of these things? What are your thoughts on that?
Yeah, so the federal government has traditionally had some really good practices for supporting replication. Sometimes they fund a center of excellence or a technical assistance center that can help states say, okay, you did it really well over here. How can other states who want to replicate this do it? We're in a moment now where the federal government is retreating from offering some of those kinds of assistance. And I think that's really a loss in terms of supporting states and municipalities that want to replicate these programs. There are other, we know from the research on collective impact, and there's terrific work by the nonprofit FSG, if folks are not familiar with it, on collective impact and systems change work. You have to have an anchor organization with a backbone staff person to kind of play air traffic control to bring all these partners together. Now, where does that organization need to be and where does that backbone staffer need to sit? Sometimes that's within government, but sometimes it can sit in another role within a United Way or a Goodwill, for example, within a Chamber of Commerce. The Nashville Chamber has really been a national leader on workforce development issues writ large. So I think one of the things to think about is wherever you are in the country, in your local community, think about who is playing that kind of backbone and organizing role, that air traffic control role. Wherever that set of relationships rests, that's a good starting point for thinking about who can be bringing these partners into these conversations and helping folks figure out, what their piece of the puzzle is. And that's going to look different in different communities, right? There are communities where the president of the community college in a rural community is the economic developer for that community, right? Because the community college has the physical space where everybody comes and uses the meeting room, and it's a gathering space and everybody knows the community college, right? There are other communities where the community college is not the one playing that role, right? There's going to be somebody else playing that role. And so I think the beauty of the United States being so decentralized is that different communities come up with really different structures to make things work for them. The tricky thing is that I can't sit here at a national organization and say, well, hey, there's one right set of actors and there's one right set of decision makers who should be always the go-to on this question. In San Diego, the workforce board is incredibly powerful. Same in Grand Rapids, Michigan, where West Michigan Works has just been tremendously effective at bringing together different partners, including around immigrant workforce development issues. So, look to where the center of gravity in your community already is and figure out how to build on that.
Yeah. I think we sometimes shortchange the power of convening, right? If you're somebody who can get other people into the room to start the conversation, so maybe there isn't a center of gravity in your community or in your state right now, think about who could be that. What's the institution or organization that other people just naturally turn to, and maybe you can get them to take on that role. I think that this is it's underappreciated that sometimes just getting people in the same room and having conversations can make a lot of difference in making change happen when they don't ordinarily do that. So something to think about. Well, Amanda, I think we're going to leave that there. Thank you so much for joining us. If people want to find out more about the National Skills Coalition and your work, where can they go to find that?
Well, thanks so much for having me and honestly for BPC's leadership on these issues. National Skills Coalition's website is nationalskillscoalition.org. We're on all your social media, so follow us there. And I'm Amanda Bergson-Shilcock, Senior Fellow and overseeing our immigrant workforce development work. Thank you so much for the opportunity to have this conversation.
Oh, it was great having you, and we really appreciate it. Thanks so much for joining us.
And that's a wrap on this episode of This Week in Immigration. Stay tuned for our next episode in 2 weeks. In the meantime, one last reminder to subscribe, rate, and review this podcast on Apple Podcasts, Spotify, or your favorite podcast platform, and share it with your friends and colleagues. You can also find more information on all the issues we discuss here on the show at bipartisanpolicy.org/immigration. You can follow the Bipartisan Policy Center on the X platform at BPC_bipartisan, and you can follow me at Jack Malday. Send your comments and feedback to us by email to immigration@bipartisanpolicy.org. I'm Jack Malday. This Week in Immigration was created and executive produced by Theresa Cardinal Brown. This episode was written by Theresa Cardinal Brown and Anna Lieb. Audio editing was by Theresa Cardinal Brown. Talk to you next time on This Week in Immigration.